My name is Michaela Goss. I'm an occupational therapist here at Pearson Physical Therapy in Broken Bow. Today I'm just going to give you a little bit of an idea of what occupational therapy is. Myself personally, I've been an occupational therapist for 10 years. Occupational therapy is actually a field that I didn't know much about when I was first attending classes at UNK. And there was a gal in my anatomy and physiology class that was majoring in occupational therapy, and I was not, familiar with the concept of it, and she introduced me to what it was all about. I knew I wanted to do something in the medical field, but the fact that occupational therapy really focused on function and really helped improve the lives of individuals, I really was drawn towards that. So I ended up transferring later that summer and went to College of St. Mary to finish my education there, and I'm really glad I had a good education there, and I've not looked back since, and I really enjoy the field. A lot of people ask the question, what is the difference between PT and OT? OT, we specialize more in upper extremity rehab, specifically hand therapy. We might focus more on balance and leg strength, where I might focus more on upper extremity strength, and also looking at, what are their visual deficits, what are their coordination issues as well that could be contributing to either falls or just lost function. So we do touch on a lot of different things, but yet we do work together. From an OT perspective, our main focus is to regain patients' ability to return to their everyday activities, what we call ADLs, which is activities of daily living. So not only are we restoring, range of motion and strength, we also look at their fine motor skills, dexterity, their ability to, feed themselves with their injured hand. I work with a lot of individuals with carpal tunnel syndrome, burns, fractures of the hand, wrist, or elbow, tendonitis, all kinds of functions, especially, after a stroke, someone might come to me with not only deficits with hand mobility, but something a little bit different than the physical therapy side of things as well. All right, visual perception is another area that I address. Things like depth perception, visual scanning, low vision aids for people with macular degeneration or glaucoma. I might even go to a person's home and evaluate their ability to safely maneuver around their house. I can also provide recommendations for adaptive equipment, including toilet risers, grab bar placement, tub transfer benches, things like that might help someone after an injury or an illness to be able to remain in their home safely. For anyone, if they have a family member or a loved one at home that is maybe struggling to meet their daily needs, they're not able to care for themselves, I may have some strategies that could be implemented to make them more independent, whether it's getting dressed, taking a shower safely. If you have any concerns with yourself or a family member, again, I would just offer up to come in and we could talk about some options if there's any way we can modify their environment or work on some of their underlying impairments to help them be safe at home for a longer period of time. There's always that option.